You had talked about your son has some self-abusive behaviors, and he's nonverbal. Um, how do you know when somebody has pain?
Mm, Great point. So I'm going to give you a very recent example. One of the things is with individuals that have behaviors similar to my son's, they will change over time. So sometimes he may be biting himself all the time. And then that might go away and he might start hitting his ears all the time. And then that might go away and he's banging his head against the wall all the time. And so the first and most important thing is recognizing that there will be change, but when that change happens, taking a moment to think, because there's been a change, might this person be trying to tell me something? And so, perfect example, literally last week, we know allergy season's tough for my son. He's on every medicine you can imagine, sprays, eyes, the whole thing. And never wakes up in the middle of the night, ever, really upset. Unfortunately, last week, woke up in the middle of the night and he was whacking his head against his knees. No one knew what to do. No one intervened. The next morning, he looked like he had been in a fight. Black eyes, obviously, to the emergency room and all. And so we have an order in place for him. If you think he might be in pain, first thing, get an order for Tylenol and offer him some Tylenol. So this went on for 2 nights before I, as a parent, was notified. And all of a sudden, they give him Tylenol, and now he's sleeping through the night again. So
Now you know
it's
there's pain that's doing something to him.
exactly. So it's that change in the behavior. And such an important question as a medical dental care provider is, have you seen any changes to the behaviors? Or are they refusing foods that they used to like to eat? Or have you noticed they're chewing only on one side and not the other side? Or any movements, maybe more, anything, any changes, in paying attention to those kinds of things. And so just to kind of elaborate a little bit on the self-injurious piece too, where it can be critical for dentists to know, you got to have those conversations with the family. Does your child have self-injurious tendencies? Tell me about those and document those things, because if that individual comes into your practice and looks like my son did with 2 black eyes, certainly you're going to document that, right? But getting to the root cause of how did this happen? Now, certainly if there are marks on the person's back where they don't have access to it, as mandated reporters, that's a whole different story. But honestly, the fact that a dentist documented we had a very bad situation in the group home and there was one bad person who was abusing my son, and my son went to that dental appointment 2 days after he was hit in the face, the person was trying to make off like he did it to himself. Turns out we were able to 100% prove it was not the case. Because the dentist documented that injury, we were able to get that person gone to trial. It's a felony. He can never work with. If we did not have that, because the first thing the attorney asked us was, "Did you take him to the doctor?" Well, he does these things to himself all the time, right? But thank goodness we did happened to take him to the dentist, and she documented it, or it wouldn't have stood up in a court of law, and that person would not have been convicted.
Well, documentation of bruises, of injuries, whether self-inflicted or, is critical for every healthcare provider. When you see a bruise of somebody's eye, you can ask what it is. You should document in the record that you see this and you asked and it was from, even if you're not taking action. That's absolutely critical to do. And there are bad people all over, and our responsibility as healthcare providers is to protect the vulnerable. and we have to think about that at all times, whether it's children or a person that has a different ability. We have to protect them.
I always say we as healthcare providers have a very unique window into their world because really their world is very secluded. There aren't many people outside of the day program and the place that he lives that get to see him on a regular basis, right? Outside of that community. And so, healthcare providers, we get that unique window and we can be incredible advocates for these
Well,
individuals.
especially a dentist that has or a hygienist that has the ability to see the patient over time. So I've been able to call to attention for family members that I think he's having some memory loss issues on an aging individual, or I think that I'm seeing some mobility issues. I see issues where all of a sudden somebody whose mouth was perfectly clean for decades, all of a sudden we have a very unique window into our patients, and just watching as people walk down the hallway looking, it's very, very important.